All right, it is perhaps the biggest single exercise to fight the coronavirus. Over 1 billion people across the country are going to be staying put in their homes today in one of the biggest national exercises to counter the threat from the highly contagious COVID-19. It's being billed as a day of voluntary social distancing. It's widely seen as a pilot for a broader lockdown that could be imposed if the spread continues unabated. Now, trains, metros will not be running. All shops, excluding pharmacies and grocery stores, will be closed during the shutdown. Businesses have voluntarily announced that they will follow the Prime Minister's call for self-quarantine. Prime Minister Modi on Thursday, in fact, stepping in to announce what he called this Janata curfew or self-imposed quarantine to break the chain of coronavirus infections. Well, our reporters will be spanning several cities as they report on how India observes this Janata curfew. But just before that Janata curfew began at 7 o'clock this morning, the Prime Minister tweeting, and if we can get that tweet up on our screens, the Prime Minister tweeting for resolve and restraint among all Indians to fight this global pandemic. He also talked about solidarity. He said, let us all be part of this curfew, which will add tremendous strength to the fight against COVID-19. The steps we take now will help in times to come. Stay indoors and stay healthy. And of course, he put the hashtag India Fights Corona.
आज प्रत्येक देशवासी से एक और समर्थन मांग रहा हूं। ये है जनता कर्फ्यू। जनता कर्फ्यू यानी जनता के लिए, जनता द्वारा खुद पर लगाया गया कर्फ्यू। इस रविवार यानी 2 दिन के बाद 22 मार्च रविवार को सुबह 7 बजे से रात 9 बजे तक सभी देशवासियों को जनता कर्फ्यू का पालन करना है। इस जनता कर्फ्यू के दरमियान कोई भी नागरिक घरों से बाहर न निकले, न सड़क पे जाएं, न मोहल्ले में या सोसाइटी में इकट्ठे हो, अपने घरों में ही रहें। हां, जो आवश्यक सेवाओं से जुड़े हुए हैं उनको तो जाना ही पड़ेगा, क्योंकि उनका बहुत बड़ा दायित्व होता है। लेकिन एक नागरिक के नाते न हम जाए और हम देखने के लिए भी न जाएं।
All right, that of course was that soundbite from the Prime Minister where he had initially announced the Janata curfew, which again he tweeted this morning. Now, India has 315 cases, confirmed cases of COVID-19 as of this morning. It's been the biggest spike in cases in 24 hours, with 79 fresh cases being reported. A woman in Pune and a man in West Bengal, both without any history of foreign travel, have tested positive, signaling a worrying trend for COVID-19 cases. A 57-year-old man in West Bengal's Damdam, a woman in her 40s in Maharashtra's Pune were among those who tested positive, and both have no travel history. Now, in Assam, a 4-year-old who was suspected to have COVID-19 has fortunately tested negative, which means effectively the northeastern states are still corona-free. And of course, the Prime Minister's Janata curfew is now in effect. So let's go right across to our reporters now, joining us live with the latest on their cities. We're being joined by Akshay, who's joining us from Mehroli in Delhi. From Lucknow, we have Alok Pandey, Rohit Khilnani joining us from Mumbai. Akshay, give us a sense of what it's been like so far. The curfew has now been in effect for just over an hour or so. What have you been seeing?
Well, Ankita, as soon as the curfew went into effect, as far as the timings are concerned, we have been seeing very few people as far as this particular Mehroli market is concerned, which in general attracts a lot of footfall. But today you can see that most of the shops are closed here. all these people who are out on the streets are because of these some grocery shops in this particular area, as there have been certain exceptions to this particular curfew that grocery shops and pharmacy shops will be open, as Prime Minister himself said that these are part of the essential services. So that is the reason that these shops are open right now. People are here coming to get their daily requirements, and we'll go and talk to some people who are inside the grocery shops because they have been working from the very morning, and let's see what exactly do they have to say. सर मैं आपसे एक बात अगर जानना चाहूँगा, कितना फ़र्क आया है आज में और पहले के दिनों में?
बहुत फ़र्क आया है जी, क्योंकि जी कोरोना से बचने के लिए हर इंसान चाहता है मैं अपनी सेफ्टी के लिए आज जो है सारे घर पे हैं। वैसे तो लगभग एक हफ्ते से जी ये चल रहा है कि इस दहशत है लोगों के मन में कि भाई किसी तरह कोई ये बीमारी ना फैले और हर आदमी सेफ्टी भी चाहता है।
जनता कर्फ्यू की बात अगर करी जाए तो क्या लोग आपको कम दिखाई दे रहे हैं या फिर अक्सर लोग इतने ही?
बहुत कम आए हैं।
अच्छा,
बहुत लोग वही आए हैं जिनको छोटे बच्चे हैं या जिनको घर चाय के लिए दूध वगैरह की आवश्यकता है, वही लोग आ रहे हैं।
मतलब बहुत जरूरत की चीजें,
जरूरतमंद की चीजें जो है वही बिक रही है,
वरना लोग घर से
नहीं निकल रहे क्योंकि मार्केट भी बंद है जी, और सब सहयोग भी चाहते हैं क्योंकि इस बीमारी से बचा जाए। बिल्कुल,
थैंक यू सो मच। सो अंकिता, दैट इज व्हाट द पीपल हियर हैव टू से, बट आई कैन अगेन शो यू हियर there are approximately 200 to 300 shops in this particular area and most of them are closed. There are some bakery shops which are all closed and on a usual day these are all open on any working day, but today as you can see most of the shops are closed. Only grocery shops or pharmacies are open. People are not coming out of their homes, which is a good thing. That Prime Minister Narendra Modi also reiterated that people have to be very cautious as far as breaking the chain of coronavirus is concerned.
All right, Akshay, thanks very much indeed for that update. Well, Rohit Khilani is in Bandra, which, well, you know, would be fairly unbelievable looking at his background. Rohit, when was the last time you saw Bandra this empty at 8 o'clock in the morning?
Actually, never, Ankita. It's such a beautiful location. We are by the sea, and on Sunday mornings, this is this is a morning walking place. It is full of joggers, walkers, runners. In fact, when there's a marathon, this is the place where people actually come and practice. Never seen it this empty. Absolutely nobody in my sight, in front, behind. But the thing is, there's a lot of confusion about, people are coming and asking us, the locals who are seeing us are coming and asking us, is this a self-imposed or will the cops stop them and send them home? There is confusion about that because Mumbai cops are sending people back. They are not letting anyone stand. While I was waiting here, they've told us also many times to go from here, to leave this place. So there's a lot of confusion whether this is self-imposed, whether people are scared if they come out and they want to go to a medical store or a general store which is open, or they want to visit a hospital. Why are cops sending them back and not letting them take public transport that is on? So there's a bit of confusion for that. But I have to show you this beautiful site that is there, completely empty. Only stray dogs are enjoying this site. This is exclusive for them for the day. There's a press photographer that you can see in the frame. And that's pretty much the scene here. Doesn't look like we're expecting anyone all day today.
Right. Well, it really is quite remarkable to see those empty roads behind you. Alok, you're in Lucknow. Of course, here in the metropolises, there seems to be kind of really a lot of information as well as directions to stay off the streets. What are you seeing there?
If I can start on a lighter note, Ankita, if one ever thought that you could hear the birds chirping in Lucknow at this busy place where I am right now, I mean, one would never have thought, but that is exactly what is happening. People are inside. It's around 9 kilometers from my home to the Ambedkar Park, where I am right now. This is the road that leads to the park actually, and there was hardly any people around. When I was coming in, I saw a few municipal corporation workers sweeping the streets, and perhaps they need to be applauded for doing that on a daily basis. Beyond that, like I said, this is the Ambedkar Park. It's a favored morning walk destination for many Lucknowites, but today there is no one, so that awareness is there that you need to be inside and you don't need to step out. While I was coming here, I saw a few people with milk selling milk on the roads, but that was about it. There was nobody else on the road, so I think it's going to be a situation where the roads and streets in Lucknow are going to be empty today. If I can just also briefly talk about the coronavirus situation in Uttar Pradesh, the number of confirmed cases now stands at 26 in Uttar Pradesh. That's an increase of 3 from Friday. On Friday it was 23. On Saturday night it was 26. One good news that came in from the KGMU, the King George's Medical University here in Lucknow, was that the first patient who was admitted there, a lady doctor, she has been discharged after 2 continuous negative reports within a span of 24 hours. So that's something that the doctors there are very happy about. But beyond that, I think it's up to all of us to take these precautions, not to step out unless absolutely necessary. And at least in Lucknow right now, you do have that example of people totally staying indoors, and not only in UP but elsewhere. For instance, our reporter in Bijnor, West UP, has sent us shots of totally empty town there. So I guess everywhere you have the same situation.
Right, Alok, you were also reporting about migrant workers now reporting to returning to parts of eastern UP, many of them coming in from Maharashtra at this point. So that's led to some crowds though.
Well, it has most certainly. In fact, if it is possible for us to play out those visuals from Devariya in East UP, I'll talk about them anyway. So at 2 in the night, there was a train from Mumbai that is going to Chhapra in Bihar and passes through Devariya in East UP. It reached the Devariya station, and you see a lot of the migrant laborers in UP go from East UP and the Bundelkhand region, Ankita. So thousands of people actually got off at the Devariya Sadar station. But the railway authorities were there. They say that they had thermal scanners on them, and they made everyone get into a line and scanned each and every person before letting them out of the railway station. So precautions are being taken. But unlike, say, a Bengal or a Bihar, where the chief ministers have spoken about, questioned the need for these trains to be returning right now, and even the Prime Minister has tweeted asking that people stay at where they are and not travel back right now. In UP, at least, these people have been allowed to exit without any issues. I'm sure in Bengal and Bihar it will be the same situation. But here, the railway authorities were prepared. They had, like I said, thermal scanners, and all of these people have gone out. But again, yes, it is a worrying situation, because you see, even in the railways, there have been confirmed COVID-19 cases. So at the moment, one does hope that people will only travel if it is absolutely necessary.
All right. Thanks very much indeed. And we did manage to play out some of those visuals. Alok, thank you for joining us with those latest details. Well, joining us this morning, Dr. Hema Divakar, who's a gynecologist. She's also running a special module on how to tackle COVID-19 with other doctors, specifically pertaining to women's health. Dr. Divakar, let me just begin by asking you, you're of course staying indoors on this day when everyone has been asked to step back to stop the chain of transmission. How important do you think it is to have this for at least, the 14 hours that we're doing today? Do you see this as a precursor to a larger lockdown if necessary?
Yeah, Ankita, I would first like to begin by saying that we are so happy seeing the visuals on your screen just a couple of minutes ago. The appeal by the Prime Minister has worked so efficiently. So we are all in India together in our fight against Corona or COVID-19 virus by being distanced from each other. This is the importance of social distancing, and it is indeed a behavior change, because the mindset of the people in India, they always love people, they like the crowds, whether it be a social or a political gathering. So it is a compulsory stepping back and stepping away. In doing so, we know very well that one day's the Janata curfew is not to be expected to bring a drastic decline in the numbers. The numbers will increase, Ankita, because it all depends on how many people we have tested in the country. Like, for example, if you test today for diabetes in pregnant women, you will find 3 million pregnant women. If you test diabetes in the general population, today you will pick up 2 million extra people. It is just because they are not tested, we don't know their status. Similarly, in the case of Corona, today we are testing only those who are symptomatic, those who have traveled into the country. So we are selecting the group for testing. That does not mean that those who are asymptomatic and those who are generally floating around in the population without themselves knowing that they have been the carriers, the silent carriers. This is the importance of a breakaway or a social distancing. So this kind of self-discipline, two adages you will relate to: health is wealth and prevention is better than cure. But preventive healthcare, the mindset for the Indian ethnic population is far from a reality. They will say, we'll see when the problem comes. The precautionary measure with the public is sensitized to by this social distancing. The kind of responsible behavior, as you saw in the empty streets, that everybody is alluding to, the appeal given by our leaders is very, very, very encouraging. This is indeed a new India, because the mindset is really changing to the caution, to the precaution, and to a greater responsibility by themselves to contain the COVID-19 menace in this great country. So the more number of testings, yes, it is projected, couple of hundreds, couple of lakhs, some millions will be diagnosed, but most of them who are in the younger age group will get away without any problems. It is the elderly and it's also the diabetics that we need to be bothered about. And of course, the pregnant women who are proactively now asked to stay home and avoid the routine checkups if they're really not necessary. So that is the scenario broadly.
Right. All right. Thanks very much indeed for that, Dr. Divakar. We're also joined by Srushti Pinisetti, a designer. She calls herself a change maker as well. Srushti, you know, as we all effectively, apart from those in essential services, stay home, do you see this as a first step, or do you see that, or do you feel that in itself this day will be significant?
I think today is significant for several reasons. The Janata curfew will at least start us off, you know, it'll put us in a mindset of what people should behave like when there's a curfew. And I think more importantly, the Honorable Prime Minister appealed to everybody to give kudos, to give credit to our health workers who are, you know, braving, you know, in the front lines every single day fighting COVID-19. So the 5 p.m., you know, get together that everyone, you know, that everyone will take a part of, to applaud, encourage our health workers. I think that's really, really significant. And I think that's something that would really boost their morale in these tough times. Right.
So, Dr. Divakar, you know, what would your advice be at this stage to women particularly, and indeed anyone who feels that they are more at risk, the elderly? Children have been asked specifically to also, children under 10 are supposed to be isolated at home. Now, obviously, it's going to be very difficult, you know, for the elderly who go for morning walks, for children particularly who can't now go out to play. What is your advice?
Yes, see, because it's now well known. See, we are talking about something about which we are still uncertain about some bit of scientific information. But given the scenario in the other countries and what little we know about this, yes, the elderly and the children, especially in our country, again, I go back to the children who are anemic and malnourished, so they are more vulnerable than children in more affluent countries, and also elderly who probably have undiagnosed diabetes or even diabetic or heart disease. They are extra vulnerable despite the age. There is some other additional, even 40, 45, 50 years, there are many in the country who have diabetes and cardiovascular diseases, so they are vulnerable. Coming to women's health space, in pregnancy, there is a good news for the pregnant women. It's still not known that COVID-19 predisposes to a miscarriage. They are unlikely to have any birth defects, and they are also unlikely to have a premature labor. Having said this, there are some advisories for breastfeeding. It is better that the mother wears a mask so that the droplet infection doesn't cross over to the baby. Non-pregnant women, yes, again the age group and the comorbidities, what we call the associated problems that they may have, like malnourished, diabetes, etc., will add salt on the wound. You know, that's where they have to be careful. So in general, the younger ones also need to be careful because they are the ones who are giving it to the others. So overall caution is a wise thing to do.
Right. We're also being joined by Dr. Ruby Makhija. She's a medical practitioner, but she's also the secretary of a resident welfare association in South Delhi. Dr. Makhija, I'd like to ask you, how important is it really for communication at the level of resident welfare associations, societies, making sure on a day like this people do stay indoors? What steps, for instance, are you taking?
Ankita, I must compliment, and Dr. Neha has summed up most of the things which I would have liked to speak as a doctor. So I'll mainly focus on the community, I would say, engagement. So RWAs play a major role when it comes to the contact of the civic agencies, of the doctors, of the medical practitioners with the residents at the grassroots level. So the information, first of all, the information which we are getting from the civic agencies, from the doctors, the authentic information should be correctly passed down to the residents. So we can have group conversations with the residents, with the WhatsApp groups in place, we can have broadcasts, but the information should seep down to the grassroots level. Taking care that the social media doesn't create a sense of panic in the residents. Reassurance through social media is something which is really required. Apart from that, as far as community engagement is concerned, if the community engagement is in place, I think 80% of it is sorted. You have to give the steps for awareness generation, things which are important, the do's and the don'ts can absolutely seep down if this engagement is in place. Now, as an RWA, a little extra from what we've done from the rest of the colonies is that we are appealing to our residents to do without the part-timer domestic maids, so that the idea is to minimize the mobility, minimize the number of residents entering into the colony and into your homes also. So if that cycle, if you can stay inside and no outsider visits you,
right,
will put you at maximum safety. So that is one thing we really have to assure, that is going to be the prime step which we can take. That is why we say social distancing. Apart from that, when we talk of quarantine, I'll be very honest with you, quarantine cannot be strictly followed for some reason, because people don't exactly know what quarantine is. When a person who has taken an international travel returns back, he is not only to be quarantined from the society, even the members staying in the household have to maintain certain norms. They have to maintain a distance of about 6 feet from the person who's quarantined, which I feel is not being followed. So the best way is to have a complete and absolute social distancing, in the sense, right, the family should not step out of their houses. Even the contacts, even the domestic helps, if you can't do without a part-timer, I would advise you to go and one step extra and make these part-timers as full-timers for a certain period. Right. If you can do that, that should work very, very well.
Okay.
We've also created a volunteers group in the colony of about 30 to 50 people, and we are preparing them for crisis management. This group is of people between 25 to 50 age groups.
Yes.
So that at any point of crisis, we have a constant touch with these volunteers, and they can further help us manage the crisis situation. Right. Yeah, a handful of people can't do it. So the appeal is to stay indoors. We've created WhatsApp group for children. We've created WhatsApp group for senior citizens who are staying without the family members. They're staying alone. We've given one volunteer to one senior citizen, so that we can keep a track of these senior citizens. We are not visiting them physically,
yes,
but we talk to them on a daily basis.
Right.
So these are some basic things which need to be followed.
All right. Thank you very much, all of you, for speaking with us. I think this is a battle that can't happen only on the government level alone. Everybody, every citizen has a right to, has a role to play over here. And of course, thank you all for bringing your different perspectives to this. We'll take a very quick break. More coming up. All right, you're watching Breakfast News on a day when India is staying indoors. This on a day when India has now also reported 315 confirmed cases. This is the biggest spike in daily cases, also with 79 fresh cases reported in just the last 24 hours. Now, a woman in Pune and a man in West Bengal, both without any history whatsoever of foreign travel, have also tested positive on Saturday, and that signals a worrying trend. This is a 57-year-old man in West Bengal's Damdam, a woman in her 40s in Maharashtra's Pune were among the 79 who tested positive. Both have no history of travel, as we said. But the roads across the country are completely empty as people abide by the Prime Minister's appeal to stay indoors in what is being seen as one of the largest national exercises of staying indoors. We're going across to our reporters at this point for more. Those visuals coming in now from Chennai, as you can see. This is Chennai's famous Marina Beach, now closed to traffic and indeed to pedestrians also. Well, Akshay joining us from Mehroli Market in New Delhi this morning. Mohammad Ghazali joins us from Panchkula in Haryana. We also have Ratnadeep joining us at this point from Guwahati. And Ratnadeep, I'm going to come to you because there's some positive news coming out of Assam. Yesterday, there were reports of a 4-year-old being suspected of being corona positive. What's the latest?
That's right. In fact, Janata curfew has begun in Assam and Northeast on a positive note. In fact, the 4-year-old child who was who was tested positive at Jorhat Medical College yesterday was retested. Her samples were retested at the ICMR's regional lab at Dibrugarh, and the report has come just hours before we went live, and it has tested negative. So this is as per protocol to do a second confirmatory test, and the second confirmatory test has turned negative. So that effectively means that Northeast India still remains with no positive cases, and that's exactly why, in fact, all the state governments in Northeast have stepped up their measures. And you can see behind me, this is the GS road behind me. This is the busiest road in the entire Northeast, and it is completely deserted. 1 or 2 vehicles are moving, a few motorbikes also we could see, but these people are basically trying to finish off their early morning work and get back to their homes. So complete all the roads are deserted, and across Northeast what we are hearing is that Janata curfew is being observed by each and every one, and all the streets, all the major locations are deserted. However, Assam did pass a very anxious night after this case of this 4-year-old child case of positive report came, and after that people were anxious. But this morning a good news has come, and the 4-year-old child has tested negative.
All right. Thanks very much indeed for that, Ratnadeep. Ghazali joining us from Panchkula this morning. Ghazali, give us a sense of how the Janata curfew is being observed there.
Yeah, Ankita, the first report, a fresh case has been detected in Chandigarh, and that's the unfortunate news coming in from Chandigarh, because the first case which was detected in Chandigarh was a 23-year-old girl, and now his friend has also been tested positive, who is a son of a senior bureaucrat in the UT administration, and that official had held a press conference last week. So most of the journalists also are trying to approach the health authorities for the COVID test. So that's one fresh case which has been detected in Chandigarh. As of the shutdown is concerned, there is complete lockdown in the Tri-City, in Panchkula district, in Mohali and Chandigarh. Though a few vehicles are plying, private vehicles are plying, but the losses for the daily wage laborers, there were some few laborers here before we went live from here, but there are many cases which the health authorities are saying that may be detected in the coming days, because there is a huge Punjabi diaspora which stays abroad, and every day cases are being detected from Panchkula, Mohali and Chandigarh. The health authorities are also trying to upload the details of those who are under home quarantine. They are putting stickers outside those residences to minimize the confusion. the health officials are also facing resistance from such people who have travel history of foreign countries, and they are also taking maximum precaution. They're also using force against those people. They are being forcefully put into home quarantine, and cases are also getting registered against rumor mongering and against those people who are resisting the health officials to go for self-isolation or home quarantine. As of now, the lockdown is visible across the Tri-Cities. Housing societies have decided not to let anybody enter or to allow anyone to go outside. Ankita.
Right, Ghazali, thanks very much indeed for that. We also have Akshay joining us from the national capital. Akshay, you've been reporting from the Mehrauli market area, which seems fairly deserted at this point. But run us through which shops are actually open today.
Well, yes, Ankita, only the grocery shops are open, only the pharmacies are open, and it was directed by the government itself that some shops of essential items will be open. But as we can see that a lot of arrangements have been done here, a lot of posters have been pasted across these markets where the SDM of Mehrauli area has directed people that they should not believe in any kind of rumors. Apart from the people who are in the grocery shops or pharmacies, the people who are outside right now are the sanitation workers. As you can see, there is a truck standing just right beside me, and sanitation workers are working round the clock to make sure that the areas remain clean, that the sanitation work continues. So, as Prime Minister Narendra Modi also mentioned that these are the people who are fighting for our country, these are the people who are protecting our nation, and even though some people have luxury to stay inside of their homes and who have the luxury to work from home, these people have to come out on the streets. But I would like to show all the shops that are closed. See, you can see there are lanes of shops that are closed, and on a usual day there is a lot of footfall. There is not a place where you can move this truck, the truck that is moving on right now, because most of the people have decided to self-isolate themselves as far as today's day is concerned and observe the Janata curfew in letter and spirit. So these are some people who are standing here. We'll go and talk to them. Maybe let's try and understand what do you have to say. Sir, एक बात अगर मैं आपसे पूछना चाहूँ, जनता कर्फ्यू है, कितनी भीड़ कम है यहाँ पर?
भीड़ है कभी है,
अच्छा,
कोई भी नहीं है, अब हम खड़े बस।
तो यहाँ पर अगर जनता कर्फ्यू है, मैं अगर पूछना चाहूँ कि आप लोग बाहर क्यों है अभी? मतलब जैसे प्रधानमंत्री ने बोला था कि सबको घर पे रहना है, तो आप लोग मतलब बाहर कैसे?
तो घर में बैठना, टॉयलेट कर आया, घर में बैठेंगे।
तो थोड़ी देर के लिए आप बाहर आए, वापस घर चले जाएंगे, तो ऐसा ही है। तो दुकानें मतलब पूरी बंद है,
सारा कुछ बंद है जी, सब नाकाबंदी है।
तो क्या लगता है इससे फायदा होगा कुछ? जो बीमारी है कोरोना वायरस,
देखो जी, हमसे बड़े जाने, हम क्या जाने, हम तो मजदूर आदमी, हमसे जैसे कर रहे हैं ऐसे
काम पे फर्क पड़ा होगा। अच्छा, वैसे काम पे फर्क पड़ा है क्या? काम पे फर्क पड़ा है? जितना भी कोरोना वायरस का डर है, इससे काम पे आपके कितना फर्क पड़ा है?
बहुत फर्क पड़ा है,
रोजगार वगैरह कम हुआ है?
कम हुआ है।
चलिए, उम्मीद करते हैं कि जल्दी से ठीक हो जाए, एंड लेट्स होप दैट द एफर्ट्स ऑफ दीज पीपल डजंट गो इन वेन, एंड this chain is broken very soon of the coronavirus. But these people, as you can see, are the real protectors of the nation at this point in time. They are not only selflessly working for the nation, but also putting their own lives at risk. What exactly is the government doing to protect these people? That is also a big question, Ankita. But this is the situation as far as the national capital is concerned.
Right, thanks very much indeed. Rohit Khilnani joining us from Bandra in Mumbai. Rohit, in fact, you were sending us visuals from outside Shah Rukh Khan's residence, where in any other time there would be hundreds of people waiting to catch a glimpse of their favorite superstar. But those are the visuals that are now on our screens today. The road outside Shah Rukh Khan's residence and again completely empty. Rohit.
Right, I'm right here, and I've never seen this empty. There are, on a Sunday outside Shah Rukh Khan's house, there are hundreds of people from morning to evening. There are tour buses coming, stopping for 10 minutes. People go and take a picture. Just take a look at this. There's absolutely empty. There's not one person outside this big. This is more like a spot where everyone who comes from outside Mumbai, even within Mumbai, they stop their car, take a picture, and go. Completely deserted. I drove from, when we chatted earlier, I was at Carter Road. I drove to this place, and our car was the only car, and along with that there were some cop cars, and there's absolutely no car on the road, nobody on the road. I saw a lot of photographers on bikes clicking pictures, and the cops, and there's nobody else. Never seen Shah Rukh Khan's house, outside Shah Rukh Khan's house this empty. We also crossed Salman Khan's house. They all live close to each other. There's absolutely nobody here, and looks like Mumbai is strictly following the Janata curfew.
Right. Thanks very much indeed, all of you. And we'll keep coming back for more updates as India decides to stay indoors to fight COVID-19. We'll take a very quick break. More coming up. Over 1 billion people across India are staying put in their homes today in what is being described as one of the biggest national exercises to counter the threat of the highly contagious COVID-19 or novel coronavirus. It's disrupted economies, it's killed thousands across the world. India now being proactive to try and break the chain of transmission by staying home for over 14 hours. It's being billed as a day of voluntary social distancing. It is actually widely being seen as by medical experts, epidemiologists, as a day of voluntary social distancing, which will be a pilot, a testing period for a broader lockdown that can be imposed if this spread continues unabated. Well, today, most public transport, including trains and metros, are not running. All shops and businesses, excluding grocery stores and pharmacies, have closed down. Businesses have voluntarily announced that they're going to follow the Prime Minister's call for self-quarantine. He made that announcement on Thursday when he called for a Janata curfew or self-imposed quarantine to break the chain of infections. Well, it couldn't have come a moment too soon. India now has 315 confirmed cases. There's been a big spike in the last 24 hours with 79 fresh cases reported. A woman in Pune and a man in West Bengal, both without any history of foreign travel, have now tested positive for COVID-19. A 57-year-old man and a woman in her 40s in Maharashtra's Pune. As we said, neither have any history of travel. The good news, however, from Assam, where a 4-year-old who had a suspected case of COVID-19 proved to be negative. Let's go right across to our reporters. Akshay joining us from the national capital. Mohammad Ghazali is in Panchkula in Haryana, and Alok Pandey, I believe, is joining us from the Ambedkar Park in Lucknow. Alok, to you first, give us a sense of how things have been this morning. You were showing us some very empty zones where normally morning walkers abound at this time. People staying home?
Well, yes, in fact, Ankita, I've shifted locations now. So I'm at the Rumi Darwaza and at the Imam Bada, which is Lucknow's most popular tourist destination. But you can see today, hardly anyone around. If you were to come at 9 a.m. on a normal Sunday, you would find this place full of tourist vehicles, and you would find a lot of people here who would have come out and actually been visiting all these monuments. In fact, that is the Rumi Darwaza in the distance. That is a very, very popular destination here. But like you see, it's very rare to actually find all of these streets empty, which does then mean that most people are staying indoors. But I just want to take another minute of your time and show you some other people who've not got the day off, who are not part of this Janata curfew, and they are these municipal corporation workers here who've been assigned the task of keeping these areas clean. I was just speaking to this gentleman. I'll speak to him again. क्या नाम है आपका भैया?
सुरेश भारती नाम है।
भारती जी, ये बताइए, आप अभी मुझे बता रहे थे कि आप लोग के लिए तो छुट्टी है नहीं, तो आपको कॉर्पोरेशन ने क्या क्या बताया है कि कैसे सुरक्षित रहें जब आप रोड पे हैं?
सर, यही मास्क दिया है और जो ग्लव्स वगैरह दिया है, शूज दिए हैं, और मतलब सुरक्षित रहें और देखभाल के काम करें जो है आप लोग।
किसी सीनियर अधिकारी ने आपकी कोई ब्रीफिंग की या ऐसा कुछ किया?
सर, अब इतना तो नहीं मालूम, जो हमारे सुपरवाइजर हैं
उन्होंने बताया,
उन्होंने हमें बताया है बस, और बाकी सर तो नहीं कुछ, जितना मालूम उतना मुझे मालूम।
सुरेश जी, आपके घर पे भी तो लोग होंगे, थोड़े चिंतित होंगे कि आप लोग बाहर हैं।
हाँ, बाहर हैं, बोल के भी आया, जो तो मना कर रहे थे कि ड्यूटी मत जाओ, जो तो हमने कहा नहीं, छुट्टी किसी की नहीं है, और सब अधिकारी आएंगे सब कह रहे हैं,
तो इसलिए आप आए हैं। चलिए, ये तो बहुत अच्छी बात है। ये आपके सुपरवाइजर हैं? सो दिस इज द सुपरवाइजर यार। आप लोग की छुट्टी नहीं है इस बार?
सर, आज छुट्टी नहीं है, हम लोग मिशन पर हैं, कोरोना बीमारी जो चल रही है उसी के मिशन पर हम लोग काम कर रहे हैं कि कहीं गंदगी ना हो, कहीं कूड़ा ना हो, सब उस पे ही काम हो रहा है। सब सफाई रोडों की है, नालियों में ब्लीचिंग वगैरह डलवा रहे हैं हम लोग, चूना डलवा रहे हैं कि कोई पीड़ित ना हो।
पर्सनल सेफ्टी का ध्यान कैसे रख रहे हैं?
अपनी पर्सनल सेफ्टी का ये है कि नगर निगम ने हम लोगों को प्रोवाइड किया है वर्दी, जूता, ग्लव्स, मास्क दिए गए हैं। जैसे ये मास्क है हम लोग के पास, इसी की सेफ्टी है हम लोगों की।
आपके घर वालों ने मना नहीं किया बाहर जाने से?
नहीं, मना तो किया है बहुत कि ना जाइए, लेकिन हम लोग की ऐसी ड्यूटी है कि हम लोग 24 घंटे उपलब्ध रहते हैं। रात में भी फोन करते हैं तो रात में भी आना पड़ता है हम लोगों को।
चलिए, आप लोग को गुड लक, अच्छे से आप लोग करिए। So there you have it, like I said, not only us, but these people are doing a far more important job. They are out here cleaning these streets, something which is very, very important. So yes, a Janata curfew being followed here in Lucknow, but those who have to be out there are out there.
All right, let's also go across, if we can, to Sneha Koshi joining us from Thiruvananthapuram this morning. Sneha, give us a sense of how this is working out there. I mean, obviously, in terms of public transport and so on, there are guidelines in place. People have already announced those closures. But what about citizens?
Well, Ankita, the visuals that you can see on your screen, the railway station absolutely empty. You have an ambulance there and some police vehicles there, but that's just about it. No public movement whatsoever. The streets that you see are some of the busiest main streets in Kerala. No movement at all. So people largely, at least 98% in the main city, staying right inside. It's early in the morning, as in it's 9:30 usually. For a Sunday morning, it's a little late, so we'll have to see for the rest of the day. But as of now, most of the people really staying indoors. In fact, in Kerala, the Chief Minister has also supported this Janata curfew. He has said that he is going to be endorsing the Janata curfew at this point because it is important to stay indoors and to give that message out. The message of social distancing has been ingrained again and again and again by the Chief Minister and all government officials here in Kerala. Many of the tourist places, top tourist places, have for almost a week been totally out of bounds. Schools have been totally shut. So this perhaps another way of just drilling it into the system that please socially distance yourself. Politics in no way coming in between at this point. But also, Ankita, it will be interesting for me to say, while most of the religious organizations, whether it be mosques, whether it be temples or churches, they have largely started distancing themselves, telling people not to come in, whether it be for the Friday prayers or Sunday services. Many of the churches or the mosques are saying people stay back, watch it online, do your prayers at home. But there have been some very scary incidents, like we had a huge rush of thousands of people out on the streets in Thiruvananthapuram last week. There have been similar instances even in other places. There have been places where people have gathered at mosques also in some parts in Kerala. So now strict action has been taken. Police has actually gone and filed cases against all these gatherings which were seen over the last 1 week, whether it be the Sri Krishna Swami Temple Festival or even the Muslim Jumaat, which had around 300 people. So all of these actions now coming in very strongly. Locally also, in the state level, Chief Minister has already said if most of the religious organizations have come ahead voluntarily accepting that socially distancing themselves is crucial at this point. But if they don't, strict action will be taken, and that's also warning being given out to individuals per se. So people largely staying indoors. Ankita, importantly, we must also remember Kerala has been consistently reporting cases, positive cases. There's been increasing testings, but just yesterday we had 12 more positive cases. So that also has, the administration has already been taking a lot of steps, and now they're literally seeing that this may go up to a steep curve, considering there were some people who were supposed to be in quarantine but were out there in the society mixing with people, absolutely mobile, and their contact tracing has brought in many people at the threat of what could be suspected cases, and they are under observation.
All right. Thanks very much indeed for that, Sneha. Let me also go across to Rohit Khilnani joining us from Mumbai this morning. Rohit, you were talking about how the absolutely empty roads outside Shah Rukh Khan's bungalow, Mannat, is not a sight you see very often.
Absolutely. I'm still here, and you were wondering if anyone will turn up here There's absolutely nobody. I'm only seeing BST buses that are plying, and also BMC's garbage truck. In fact, there's a garbage truck coming our way. This is the road outside Shah Rukh Khan's house, and this is Shah Rukh Khan's bungalow. I also want to show you where this is, and this is usually a tourist spot. There's a small garden here outside, and immediately after that you see a sea face. There's a sea right here. Never seen it this empty. What the usual exercise on Sunday morning is, there'll be tourist buses that will stop here for 5 minutes, let people take pictures. They will go to this park, have some sandwiches, and then leave. None of that happening here. Clearly, Mumbai. Also, it's not very difficult to, Mumbai police is trying their best to keep people off the streets for health reasons. You can see garbage trucks, and that's all you can see today on these streets. It's not difficult to implement this because it's also Sunday morning, and not many people are out. Clearly, they are following all the directives given by the Prime Minister and the Maharashtra government as well.
All right, Rohit, thanks very much indeed for joining us with that. Let's also go across, if we can, to Ghazali, who's joining us from Panchkula this morning. Ghazali, give us a sense of, how shops have closed down, everything pretty much except for pharmacies and grocery stores.
Yeah, Ankita, except the essential commodities goods, rest of the shops are closed down. And in Punjab, I'll tell you, yesterday it was announced in 6 districts that there will be complete lockdown for the another 4 days in big districts like Bhatinda, Jalandhar and Patiala. Along that, there are other 4 districts where the lockdown was announced for another 4 days. The real concern in and around Chandigarh is in the slum areas where people are not able to maintain that social distancing, which has been appealed by the political leaders, by the Chief Minister, by the Governor, UT Administrator as well. Though sanitization program is going on, the UT administration is trying to clean those places, those public spaces, but the impact of lockdown is visible across the Tri-City in all the both the states of Haryana and Punjab as well as Chandigarh.
All right, Ghazali, thanks very much indeed for those details. Let's also now try and go across, if we can, to our guests, if we have them. All right, we will take a break first and be back with more. All right, let's also now get a view in from guests joining us on the program right now. We have with us Ashwajit Singh. He's Managing Director with IPE Global. Thank you for speaking with NDTV. Give us your perspective on how you see this Janata curfew helping to fight COVID-19.
Thank you. I think the Janata curfew is more about creating an awareness. It's a step in the right direction. It's about creating an awareness about the seriousness of the coronavirus. Also to acknowledge the good work being done by the health workers and the essential services staff as well. It's really there coming from the Prime Minister, popularly like the Prime Minister. It's there to really motivate people to try and stay together in this moment of crisis. Having said that, I think it's a good first step or a good step, but it's far from what needs to be done. We need some more very drastic steps to be taken. This is a good gesture.
What are those in your opinion?
Frankly, I think we're really heading for a lockdown. It's an emergency or a warlike situation. 1 day's staying at home is not going to solve the problem. We really need to take more drastic steps. We should be looking at maybe 2 weeks of total lockdown. Nobody being allowed to step out of their houses other than the public health workers and the essential services staff. We've seen that happen everywhere in the world. And now with the private sector testing starting next week, I fear the numbers in India are very underreported till now. And once we get the private sector testing in place, I fear that the numbers are really going to shoot up over the next couple of weeks. And for us to be able to try and control that, we need to act now. We can't wait for another week, 2 weeks to really start acting. So it's really something we need to look at. We also, of course, have issues around economic issues. We have issues around medical issues. We don't have medical facilities. So probably we need to start cancelling the leave of anybody who's in the medical staff. We need to try and get back people who are retired. UK and some of the other countries have done that. We need to train the ASHA and the Anganwadi workers, the self-help groups to try and address this problem. And more important, we need to also decide what are we going to do for the daily wages and the laborers, because once you go in for a lockdown, yes, it might defer or control this disease to some extent, but then that's going to come up with more issues around the economic issues. So probably we might.
I think that's a very important point you're making, Mr. Singh. You know, for daily wage laborers and workers, even a day like today, for instance, would be, I mean, these are literally people who, you know, eat if they make money for the day. What kind of social security net do we now need to look at on a nationwide level? Yes, certain states have come out with announcements, including Uttar Pradesh just yesterday or so. But does there now need to be a national policy about what needs to be done in the event of a larger, longer lockdown?
Probably, yes. We should consider a number of issues as far as the daily wages and labor is concerned. We should be even ready to provide food packets if required, because the first issue is about survival. We can talk about economic recovery at a later stage for the corporates, etc. But today we're talking about survival of these people. So food packages, maybe using a direct benefit transfer. We've already got the Pradhan Mantri Kisan Yojana scheme, but even using the Jan Dhan accounts to try and get some money transferred to some of these people. And also assuring the corporate sector that they need to continue paying temporary and daily wages, because a lot of people are laying off temporary wages right away. So the government needs to come up. They may not come up with the details of the scheme, but a broad scheme like the UK government's really said that they're going to cover 80% of the wages in case corporates really are unable to pay that. But maybe not as high as that. But we need to come up with this needs to be done in two phases. One is, what do we do now in terms of the next 2 weeks? And then how do we really look at economic reforms thereafter?
All right. Thanks very much indeed, Ashwajit Singh, for joining us and giving us your views on what the road ahead could hold.
Thank you. I'd like to just mention here that the problem is far more than what we think. I've spoken to friends in Italy, in Spain. There's so much of a stress on the medical facilities. The people are fighting over ventilators, fighting over, being hospitalized. And I fear that we are going to be heading for that if we don't go ahead and have a lockdown very, very soon. We've already announced the work from home for our staff.
But Ashwajit Singh, do you believe that, just a lockdown is enough, or should we be looking at this point at ramping up medical facilities in the best way possible? Also, doesn't it have to be a holistic approach? I mean, for instance, China showed the way when a stadium was converted into a makeshift hospital. Do we need to now create more beds, more ICU units, have more ventilators available? All of this has to be really a combined response, does it not?
Absolutely. We need to get in, whether it's the army barracks, whether it's the hotels which are vacant right now. No hotel is doing well. Whether it's vacant flats or even certain wards of hospitals. We have to get the private sector and the public more involved in. Everybody needs to come up at this time. India has to be united beyond party lines, beyond religion. And I think we all have to fight this war against coronavirus together. And that's the only way we can do that. So it's not just one issue or one step that's going to resolve the issue, but a number of multiple steps at the same time need to be taken.
All right. Thanks very much indeed, Ashwajit Singh. Appreciate your being with us. All right, let's, speaking of the world fight, the global fight against the pandemic, let's get to the latest numbers. Over 13,000 deaths now globally. And in fact, Italy leading the pack with over 4,800 deaths. Now, 793 new deaths reported in just the last 24 hours. Italy really has been struggling in the last few days. Spain and Germany have also seen a steep rise in cases. The US now reporting over 300 deaths and well over 26,000 cases. Perhaps the only silver lining in all of this is China. Wuhan, the epicenter of the outbreak, where it all began. Wuhan has seen no domestic cases now for a fourth straight day. So Italy really leading the pack globally in terms of both active cases as well as the number of deaths. Spain following with about half the number Italy has right now. Iran at 11,000 odd active cases and over 1,500 deaths. France at 13,885 cases, 562 deaths. China now not reporting any fresh domestic infections, but it has seen now some imported cases or cases from other countries entering China. We will take a very quick break, but be back with much more, including the latest headlines. And of course, coming up next, our coronavirus call-in show, where we ask you to call in with your queries on coronavirus. Not just the infection, we can talk about the Janata curfew, we can talk about what the need for a lockdown going ahead. Medical experts, epidemiologists, people who are dealing at the front line of India's COVID-19 outbreak, joining us as experts on the show. Coming up in just a moment, our lines go live. Do call in.